Hi, I'm Dr. Lou Walters at the Source Wellness Center. Flu season is in full effect. It is spread across the country and is hitting every state pretty hard. Influenza is a viral infection. It infects the lungs and the upper respiratory tract. Essentially, it looks like a cold on steroids. There may or may not be a fever, sore throat, headaches, runny nose, cough, malaise, generally feeling pretty crummy, lots of fatigue. The reason why we worry about the flu is that it can be quite debilitating and even dangerous, especially to the very young, to the elderly, and those that are immune compromised. It can weaken us to the point that it allows secondary infections to take over and cause pneumonia and other issues that can be fatal as well. Now, because it's a viral infection, antibiotics are not going to treat the flu. Antibiotics only work on bacterial infections. There's got to be other treatments that we need to do for viral infections, especially the flu. Now, if you feel like you have the flu or are coming down with the flu, you should go see your doctor. The information in this video does not replace the need for you to get care by your doctor. There is a lab test that can be done to confirm whether it is or is not the flu. As far as treatment options, there is a pharmaceutical called Tamiflu. What Tamiflu does is it prevents the virus from replicating or creating more of itself and preventing it from infecting more cells in your body. Tamiflu works best if it's given within 2 days of the onset of symptoms, and it can be given to small children. Alternatives to Tamiflu from a naturopathic standpoint, one is fever therapy. Now, fevers are not the infection, it's the body's response to the infection. What the body's trying to do is increase the body temperature to 1, physically cook the bug, and 2, our immune cells that fight the infection work better and more efficiently at a higher temperature. So when we take anti-fever medications like aspirin, ibuprofen, Tylenol, Motrin, that tends to lengthen the course of the infection. Studies show roughly 2.5 days longer for those that take those meds. Now, a couple issues with fever. As we get older, it takes more energy and effort for our body that we may or may not have to be able to get a fever. So for those people, I have them try to create an artificial fever by taking hot baths, hot showers, or sitting in a sauna to try to physically raise their body temperature as if they were generating their own fever. For kiddos who tend to get high fevers, we worry about it getting too high. So if it goes over 106, we start worrying about the risk of brain damage. For those kids, and the medicines are an option, and that's between the parents and their physician, whether or not they feel that those are necessary. An alternative would be a room temperature bath that the child sits in for 15 to 30 minutes with the parent monitoring the temperature to make sure that it's being effective and it is coming down. Other things that a person can do for the flu, plenty of fluids, lots of rest. There's different herbals, whether it be in a tea or a tincture, that have antiviral properties. Things like echinacea, osha, golden seal, elderberry. Foods that person can eat, soups and broths with fresh garlic or ginger root. Those are antiviral as well as help thin mucus if that's an issue. Things like castor oil packs help bolster immune function, different hydrotherapy treatments, besides fever, things like warming socks. And plus there's an infinite number of products on the market that are supposed to help with immune function. What I do in my practice with my patients is I treat people, not diseases, so I look to see what I think is going to have the biggest impact for that individual person. You and your doctor can figure out what's best for you. Now, if you don't have the flu and you want to try to avoid it, there are steps that you can take. Number one, we want to strengthen your defenses. So the number one and first line of defense is our mucous membranes, the inside of our nose and our mouth. To make sure that those are supple and strong, we want to stay hydrated, drink plenty of water. When we get dehydrated, what happens is we get little cracks inside our nose, which then if we're exposed to the virus, there's a big opening in our body and the virus gets in and can take over. The second thing is we want to make sure that the conditions in our body are not favorable for the virus to grow. So when we eat lots of sugars and starches and junk food, all that creates an environment that is favorable for the virus to grow in. So we want to avoid those foods. Another thing is getting plenty of rest and making sure we're not under excess amounts of stress. When we're under a lot of stress or we're not getting good sleep, we produce an excessive amount of a hormone called cortisol that suppresses our immune system. It basically takes our army and tells it to stand down. So it allows the virus to take over. It's no surprise, given that information, that every year after the holidays we see a big rise in the number of flu cases in the country. During the holidays, we tend to be under a lot of stress, eat a lot of junk food, don't get a lot of good rest. Other things that we can do are washing our hands frequently, making sure we're not touching our face, and making sure we're getting adequate amounts of vitamin D, which our immune system needs. Especially up north, we want to be getting vitamin D through the winter. A lab test can determine what your current levels are, and that helps us guide how much we should supplement. Again, these recommendations are not intended to replace the need of you going to see your doctor. Make sure you get good care. Be well. Again, I'm Dr. Lou Walters at the Source Wellness Center.